For me, the vaccine is extremely important, and I have no reservations about it. I'm excited to receive the vaccine. I'm excited to go first so that I can share the word about the vaccine.
My job is to help take care of people that are sick. And if I fall ill with this and have to be mandated to be out of work for a 10-day period, that's a big strain at a time when we need all the hands on deck that we have. So that's the principal reason. I know what vaccines are capable of. I know what they've done for us as a society, and I'm certainly a proponent of their use.
It's extremely important for our community to be educated on the vaccine, make sure that they are reading up from valid sources about the vaccine if they do have reservations, because without this vaccination, we will not be able to get a handle on this pandemic.
I think anything that moves us towards not having to see as many cases and people affected by this disease, it takes a tremendous toll on the folks that fall ill with it. And it's certainly true that a lot of people get this disease and do just fine. The vast majority of people fall into that category. But the ones that land here, in a hospital room by themselves without their family, talking to them over the phone every day, trying to update them about a life-threatening illness that their family member have, it's pretty horrific. It's the worst thing I've ever done in 25 years of being a physician, no question about it. And so if we can mitigate that and make that less, we're all about that.
Seeing it firsthand here at Spectrum Health, seeing our hospital beyond capacity, seeing the patients suffering because they're not able to breathe because of COVID, seeing patients die without loved ones at the bedside, or even here hospitalized without a family member because we have to have visitor restrictions in place. All of that is heart-wrenching for us as healthcare workers, and this is the part of the pandemic that we want to see an end to, and this vaccine is what will get us there.
But it's incredible science. I mean, what's being done with this vaccine is amazing work, and I think there's a lot that we don't know, and I think we have to be honest about that. I think as healthcare workers and as people talking to the public about this, we have to be honest that there are things that we're not going to know. We're not going to have as much information as we would like to have. But these trials have had a lot of patients, and 44,000 patients in the one that we're thinking about right now. That's a lot of people, and so looking at that very carefully over that time period. But admittedly, those patients are being followed for a couple of months, and so we're going to have to obviously let people know that we're going to learn more as time goes on.
I look forward to getting as much as my team vaccinated as possible so that we can spread the word to the community